Aye.
Trustee?
Aye.
Amanda? Aye. Chair votes aye.
Should they know as Pepsi?
Sorry.
Yes.
Yes. Okay, I make a motion that we approve Pepsi as our new beverage, for our new beverage contract for the next 5 years.
Second.
Call for a vote. Matt?
Aye.
Justin?
Aye.
Trustee?
Aye.
Amanda? Aye. Chair votes aye. Item 6, teaching and learning. 6.1, discussion, consideration, and vote to approve or not to approve Bixby Public Schools Return to Learn and COVID-19 Protocols and Procedures Guide for 2020-2021.
That's a mouthful. I know that we are going live here, so this is a little bit unusual where we're doing a live stream for members of the community who wanted to be part of this conversation anyway, or engage in viewing this, as well as we've got an audience of about 20 to 25 teachers, staff members, I believe maybe some family members here as well. So for those of you who are tuning in on YouTube, we welcome you. This meeting is already in progress. This is our monthly meeting of the Board of Education for Bixby Public Schools on Thursday, July 16th. We started the meeting at 6 p.m. today, so we've done some business for the last 33 minutes, but we wanted to live stream this portion of our board discussion because we know it's certainly a high interest item, and we wanted to make sure that our community has access to that discussion. There are a couple links that we've already posted that are accessible. The PowerPoint presentation that we're going to share with the board here in just a few minutes, as well as a 12-page document that includes our protocols and procedures for the reopening of schools with COVID-19, which has really changed things quite a bit. I wanted to kind of give some parameters, especially for those who are viewing online. This is a regular Board of Education meeting, so it is a business meeting. Therefore, we did entertain public comments prior to this item. We had one speaker who spoke on behalf of the wearing of masks by students and staff due to air sanitation standards. So that's certainly part of the overall discussion that we're going to have today. But for the most part, we will not be entertaining questions from the audience here. It's not a town hall meeting. There is no access to post questions on this in a live format because it is really a discussion between members of the Board of Education and our district staff about the plan and the framework that we have put together. That does not mean that we are trying to curtail the feedback from our community. So family members, community members, if you would like to provide feedback, especially after tonight and having a chance to read through the procedures and protocols, and you have suggestions or ideas, there is a link for you to post those, and I guarantee we will read every single one of those. The plan and framework that we're going to be sharing with the board tonight is not set in concrete. It is based on the best information we have today. And we know with the changing conditions with COVID in Tulsa and in Oklahoma, that those decisions could change even between now and the start of school. I wanted to begin really by thanking my wonderful team. This summer is always busy for school administrators. I know a lot of people think, what does the district staff do in the summer? But there's a lot to do with policy and handbooks and prepping our schools for the return of students in the fall. This year we've piled on a lot of extra work. And so my team, Associate Superintendent Lydia Wilson, Assistant Superintendent Jamie Milligan, Executive Director of Curriculum, Teaching and Learning, Sherry McMillan, Jessica Jernigan, our Community Director of Community and School Outreach, and many more people, Amy Renault, a long list, and I know I would leave names off, but it has been a team effort, and these individuals have truly spent hundreds of hours. We've also included our site principals, assistant principals, nurses, counselors, and a wide range of people who have helped off contract help us develop these procedures. And thanks very much to all of them for their involvement in this plan. As we said, it's what you're going to hear tonight is just the executive summary of the planning. There are many, many layers beneath that. So let's talk about the plan right now. And I know that everyone is already aware that school will reopen in Bixby on Thursday, August 13th. That is 4 weeks from today. That sounds early, but that is the approved date set by the Board of Education back in November of last year. So we haven't adjusted that date at all. As of August 13th, students will have been out of school for 153 calendar days. Bixby, 153 calendar days. So when we make this announcement about the reopening of schools, there is certainly a chorus of voices around the community, parents, family members, students, teachers, who say, hooray, it's about time we get back to school. And honestly, I'm part of that group most of the time. I'm very excited to get our teachers and our students back in school and to serve our community and our families. At the same time, I think it's very important for us all to recognize that there's a significant set of voices out there who have reservations, who have concerns about the reopening of school. And they're thinking to themselves, oh no, it's too soon. So I think it's valid for us to recognize this disparity of opinions because they all have legitimacy. And there are science and medical evidence to support different points of view when we talk about COVID. There are issues of practicality that come in, and there are really authentic and valid emotions related to discussions of COVID. And what I hope is that as people have time to read through this plan, hear our conversation today, that no matter where you are on that spectrum, that you'll be able to see that your voice is represented somewhere in this plan, and that we have tried to be as thoughtful and considerate of a wide range of perspectives in drafting this plan. And as I've said, nothing is set in concrete today. The board, hopefully after our discussion, is going to take a motion to approve or not to approve this framework to our plan, but it could change and may change certainly in the next week, next 2 weeks, or 6 weeks from now. So that's important. I want to make this crystal clear that all of our planning, the work that our team has done, has not been driven by political considerations. And we're all aware of the political influences that are out there today. Our objectives are to reopen school as safely as possible. And the reopening of school is not a political decision. It's one that's based on evidence, and it's based on the needs of children, not just academic, but social, emotional, mental. And we're trying to capture that and provide the services that our students need while implementing appropriate safeguards to keep our students and staff members safe at all times. Masks, I know, is a contentious issue. The wearing of masks or the non-wearing of masks should not be a political issue. It should be a consideration to help us mitigate the potential transmission of COVID in our schools. Because our key objective, again, is not only to reopen schools safely, it is to keep our schools open. So as we talk through this plan, I want you to consider those different points of view. And I think what we've tried to do here is build in some flexibility so that as conditions change, either for the better or for the worse, we have some parameters in place to address those changing conditions. I'm going to say this very loud and clear, and I want all of our teachers here, I want our families to hear this, I want our board members to hear this, because this is critically important in that we have a plan, and we hope to be able to open school safely and keep it open. But if we ever get to a point where we feel that we don't have the capacity or resources to adequately safeguard the health and welfare of our teachers, our staff, and our students, we will close schools and we will resume a distance learning model. That's a non-negotiable. And there may be some loud voices out there who may object to that. There may be some political pressures, but we are not going to compromise the health and safety of our students or staff to obtain that objective of staying in school, if we get to that point. And I'm hopeful that we do not. And so when you read through the plan, you're going to see some procedures that you're not fond of. In fact, I've said facetiously with our team, there's something in this plan for everyone to hate. But, and there's parts of it that I don't like as well. But at the end of the day, we're going to listen to experts and we're going to try and read as much research as possible. We are in constant communication with the Tulsa County Health Department. I'm in constant communication with superintendents of surrounding schools, with the State Department of Education, reading CDC guidelines. The American Academy of Pediatrics has published guidance. We're trying to absorb as much of that as possible, but with the overarching goal of opening schools safely and keeping them open. And with that, let's go to our slides. And as I said, these are just a summary. So please take the time, if you're viewing from home or if you're in the audience, take the time to read through the 12 pages, especially the different levels that we're going to dive into here in just a second. And I think you'll see where we're trying to get with this plan. So the key points, I've already touched on some of those: reopening our schools safely, what the scope and purpose, we're going to cover that, our COVID-19 monitoring and decision-making matrix. We're going to talk about our instructional models, because I know that's a big area of concern, and people have a lot of questions, especially based on our experience with distance learning last spring. Mitigation protocols, what things we're going to put in place to help mitigate the transmission of COVID and stop it before it ever gets started. Physical distancing, other procedural changes, masks and face coverings, sanitary and disinfection measures, things that we're going to do to help keep our buildings and classrooms clean. How we're going to respond to either positive or suspected cases of COVID. We're going to have them. We've already had some this summer. We're going to have more in the fall. It's inevitable. And how we respond to that is going to be very important in keeping our schools open. And then we'll talk briefly about some of the personal protective equipment that we'll have available. The reality about COVID-19 is it's a pandemic, and we know that the numbers here in the Tulsa area have risen to all-time records over just the last month. I will share with you the results of the survey that we put out on July 1st. Just 20 days ago, the majority, in fact 85% of our families did not feel like wearing masks was an important consideration for students. 85%. I think that number would be dramatically different today. It wasn't much different for teachers. I think it was 83% said that students did not need to wear masks. So that shows you how quickly things can change in this whole conversation. In red on the bottom of that slide just repeats what I just said. We're not going to take chances with the safety of our staff. It's just not going to happen. And when we get to a point and we're not sure, we're going to err on the side of safety, and we're going to make the right decision for our students and staff. Next one. The way we have set this up, and it's a little unique from some of the other school districts around, is we have made 3 levels. There's nothing real creative about this. We've done level 1 green, level 2 yellow, and level 3, guess what color? Red. So the parameters for each of those. Level 1 right now says minimal or no active transmission of COVID within BPS. What that means is that we're able to effectively manage any cases that we do have. Because, as I said, we've already had a few positive cases that we've effectively managed. They haven't disrupted the operations of our programs. And if we can do the same thing during the school year, whether it's a student or staff member, but we can continue to have school, then we don't really need to make dramatic changes. So we'll do our regular school procedures, modified obviously with the COVID protocols. We'll do our disinfecting, and that will be enhanced from what we currently do. And then the guidelines, I know that everyone's interested in. Teachers and staff are highly encouraged to wear face coverings at all times when physical distancing is not feasible. So when you're not able to get 6 feet apart, either from each other or students, we're going to highly encourage our teachers to do that. For students, face coverings are highly recommended as well when physical distancing is not feasible. One of those circumstances is riding on transportation. There is no way to socially distance 70 kids on a school bus. We don't have the resources, the number of buses, or the number of drivers to expand our routes or to run multiple routes. We have what we have. And so as a result, we are going to require all students to wear face coverings on school buses. That's not only for their safety, but it's also for the safety of our bus drivers. Our bus drivers generally tend to be older in age, have some other health conditions. We need to do everything that we can to protect our drivers. We're going to talk a little bit more about some of the protocols that we're using for that. Also during the day, stay there, during arrival and dismissal. So at drop off, pick up, when we've got large numbers of students in the hallways moving around, we're going to expect them to have masks on. Where we loosen up a little bit is during the school day in classrooms. If teachers feel like they can adequately space students and they're not directly in front of them, then we are giving teachers that autonomy to not require masks for all grade levels. But I want people to read that last sentence there because it's important. It says individual teachers have the right to require student use of masks in their classrooms. We have teachers who have underlying health conditions where they go home every day with young children or elderly parents or somebody at home who has a condition that causes them to be concerned. And that's legitimate. And we need to make sure that our teachers are empowered with the ability to say, students, I need to have everyone wear a mask. And the administration is going to support that when we're at this level because it's reasonable and it's in the best interest of teachers. As I'll say many times, it's important that our teachers stay healthy and well because we can't have school without teachers. So we need to do everything we can to support them during this time. The last 2 bullets there really just talk about our preparations in the event we have to do distance learning. So we'll continue to collect data relative to technology, what families have, what needs they may have if we move to a distance learning model, and then providing training to students during the school day so that they can transition seamlessly to a distance learning model if that need comes up. So now we'll look at yellow. If you were to ask me today if we're yellow or green, I'm not sure I could give you a well-defined answer. We're probably leaning towards yellow, to be honest with you, because of the recent increase in cases. Will that be the same in 4 weeks? We don't really know. So this is important for everyone to understand that wearing a face mask and some of these other guidelines are dependent upon the current conditions at the time. So right now on July 16th, we could say we feel like we're at green, level 1, and have less restrictions. But 2 weeks from now, we may be clearly in the area of level 2 in yellow. There are also other movements that are beyond our control. We know that the State Department Board of Education meets next Thursday, and we've already received notification from the state superintendent that one of the items on their agenda is a mandatory mask rule. Now it will be graduated, which means it will probably resemble what we're doing here, where there's some flexibility for schools based on the size of the schools and local conditions. But they will be putting out something relative to the use of masks. So our discussion here internally or in other districts around here could become a moot point here shortly if that is passed by the state board. But what yellow means is that we've got some active transmission. So we can actually find evidence that we've got one student who had it and another student who gets it. And maybe they may have got it from each other. We won't be able to make a valid conclusion. Or we have 3 students in one classroom. So it's obvious that there's something going on where we've got some active transmission. I will point out that most of the research, especially with young children, show that not only do they not get COVID at a rate close to what adults do, their symptoms are much less, and the level of transmission from child to child or child to adult is far less than adult to adult. In fact, in some studies done in Europe, they are unable to find a single verifiable case where student to adult transmission. Now that could change. Again, this data is constantly, and when we bring millions of students back into schools in the United States, they may come back and say, hold on a second. Yes, we now do have child to adult transmission, but right now that research is pretty incomplete, to say the least. So when we have yellow, whether it's at a school site or district-wide, we're going to have to make some additional decisions. One of those decisions, if we have an outbreak at a single school, is we may need to move to distance learning and close that school for 24 hours to 72 hours so that we can get our maintenance crews in there and do a deep cleaning of those classrooms and those common spaces in that building. It just takes time, and in order to do that, we may have to close that school. It may just be that school. So if it was North Intermediate, we close them for 24, 72 hours, other schools remaining in place if there's not that active transmission in those other schools. That's important for parents to know, because I cannot stand here, and none of us can, and promise that there won't be disruptions to instruction this year. Until there's a widespread vaccine that's effective and safe, and other therapies out there, we simply have to plan for disruptions and manage those to the best of our ability. So when we move to yellow, the issue of face masks or face coverings kind of goes away. We're going to wear them all ages to the maximum extent possible. We recognize that for young children, pre-K to grade 3, that's a huge challenge. And for any of the teachers out there that teach elementary kiddos, you're going like, oh yeah, you come try and keep masks on my class of kindergartners. We understand the logistics and the challenges behind it. So there'll be a little bit of flexibility certainly for those younger kids, but middle school, high school, it will be an expectation. What we'll have to do if we get to that point is we're going to have our teachers provide opportunities for kids where they don't have to wear a mask, mask-free breaks, because we know that wearing this for 6 or 7 hours is a long time. We don't have a solution for cafeterias other than doing some social distancing, staggering schedules. We've talked with our principals to look at options for how we could do that if we go to yellow to reduce that, but that's one of our vulnerable spots is the cafeteria. We got to feed kids. Recess is a huge thing for young kids, and I can't imagine eliminating that recess time for kids. So we're just going to have to do the best that we can in keeping our equipment outside clean and sanitary for kids. And they'll be outdoors, so that hopefully will reduce the opportunities as well. At this point, we're really starting to work with our local health agencies and developing additional protocols, more social distancing, that sort of thing. And it may affect our fan participation at sporting events. That's a whole another issue that we really haven't dove into yet. Okay, and finally, red is basically the state. If you'll switch to that one. We've got significant active transmission of COVID in our school site or district-wide or in our community, and we really have overwhelmed the capacity to respond, which could mean we have 20% of our teachers who are out, either because they're sick or they've been exposed to someone who was sick and are quarantining. And when we reach that point and we don't have a sub-pool that's large enough to fill that need, we will have to close. Likewise with bus drivers. If we get down 10 bus drivers and we can no longer adequately transport students, then we're going to have to make some decisions about whether parents need to drive or whether we just need to close schools in that case. And then we'll move to a distance learning model. This is not what anyone wants, but we don't control all the circumstances that might get us. So we've got a plan for it if we get there, and we'll talk about that next. So let's look at our models for instruction. And these are no different than what you've seen if you've been following what's happening in districts around us. There's really only 3 ways to do this. One is in-person learning. It will look different though, even when we start on August 13th. We'll have regular classroom instruction as normal, but we'll also be integrating from day one the use of a platform called Exact Path. This is a program provided by the State Department of Education to help students in math, reading, and English language arts. That will be integrated, especially in the elementary curriculum, early on, because if we need to move to a distance learning model, that could become a key component of that delivery system. It will also provide teachers with a tool to remediate students or provide enrichment for some students, because they can tailor those lessons and activities for individual children that are in that. We know that kids, when they come back, are going to have some gaps. It's estimated that in math, it could be as much as half a year or 6 months of learning, and in reading, it could be 4 to 6 months as well. So we know that we're going to have to do some things to help kids catch up. We've already talked with teachers. I know our teachers are working with principals on how to maybe even restructure the instructional time that we have in the school day to focus on those reading and math skills and get kids caught up. We've also got SEL, that's social emotional learning. We've got a curriculum that we're ready to deploy. We know that we've got kids coming back who are going to have some needs that we need to address and help them work through, I'll use the term trauma, but the anxiety and stress that are related to this. And much of that is carried from home. Much of that is just natural with young kids and uncertainty. And then we'll follow our COVID protocols, again, with the purpose of mitigating transmission. The full-time virtual. We know that we're going to have more families than normal who opt for full-time virtual, that have concerns, that have medical issues, that have children who have diagnosed conditions that cannot take the chance of returning to school as it currently is, even with enhanced protocols. So what we've developed is 3 different learner management systems for K2, which typically is not a great time to do virtual instruction. We will use the Exact Path, which again is math, reading, English language arts, and teachers will supplement for social studies and science to make sure they're receiving content in those areas as well as specials and electives. We'll try and build that out as best as we can. But for those young kids, it really is math and reading. We want to make sure that they're getting the skills and knowledge that they need. OdysseyWare is another online program for grades 3 through 5 that's already available. This will be a semester long, so if a parent opts to choose OdysseyWare full-time virtual for their student in grades 3 through 5, they will enroll in a semester to maintain continuity of instruction and to avoid those issues related to grading and presenting more gaps in their learning. And then for high school students and all the way down to grade 6, we'll use Canvas at grade 7 through 12, but then Ingenuity is the platform for those students. These will be built out and ready to go. We will be asking parents to, if they're committed to going to full-time virtual, to contact their principal next week to get more information. The principals will then share the instructions for them to apply for full-time virtual. We will have technology available for families who need it. And we'll have a process where they will apply for that technology, a Chromebook, a hotspot if needed. We've got limits on the number of that, but we'll do everything we possibly can to support a parent's decision to keep their child home as best we can. The final option there is the distance learning. Vastly different. I understand the criticism about the levels from last year, but I want everyone to remember that we were under some guidelines and restrictions from the State Department and we had very little time to pull a plan together. We were told how long we could have students engaged in academics. We were guided in trying to reduce the amount of stress on families who were going through a very turbulent time. Many were unemployed and had multiple children doing various programming. And so we really scaled that down just to give students opportunities to remain academically engaged, but it wasn't designed to move kids forward. This year it will be, and it will be a continuation of what's already going on in the classroom. We'll be using Exact Path, for math and language arts. Teachers will be using Google Meets and Google Classroom, pushing out digital resources. We will have a regular schedule and expectations that is provided for parents. So if we're going to kind of replicate a 6 or 6.5 hour instructional day, that may be a 4 or 5 hour digital day, because again, we're not doing some of the transitions and specials, but it will be much longer, much more involved than it was last year, because we simply cannot afford to have kids fall even farther behind. The blended model, which you've seen in some districts, we already have available for students in grades 9 through 12. What that means is if I'm a student and I want to take 3 of my classes on campus, I can do that, and then I can do 3 classes virtually, either at home or in a lab supervised at the high school. So that's already available. We don't have that kind of a blended model for grades 8 and lower, just because of the need for support for students of that age. So I'll stop here because I know Sherry and Jamie have a lot of, they've spent a lot more time in this territory. Are there questions from the board about any of these models or about any of the levels before we move on to some of the mitigation protocols?
I have a question.
Yes, Mr. Chief.
I would like some clarification, just like you said, I like and hate this all at the same time. I know the mask issue is a big issue. We've had a lot of emails from parents, and I appreciate all of those. Every opinion matters. But the thing that concerns me is, where do we draw the line from level 1 to level 2? You mentioned earlier, you weren't sure if we're at a level 2 or level 1. My concern is if we just jump into a level 2 and stay the entire time, how do we make the determination of whether we're going to be in that 1 or we're going to be in a level 2? I know it says spread among the school district. Just some clarification on how we are going to determine what level we're in.
That's a great question. And unfortunately, I don't have a solid answer for you, because part of this, we're going to have a COVID response team, and we're going to have different committees that represent different groups of people that are on that. We're in the process of bringing that team together. Part of that team will be somebody from the local health agencies, Tulsa County Health. And a lot of these conversations about where are we in terms of transmission in Bixby schools or in the Bixby community are going to be between those health agencies and ourselves. And so if I get a call from Tulsa County Health Department because we've had a significant outbreak in the Bixby area, we can expect that outbreak will start to transmit itself into the school. Or if we have a significant outbreak at one of our schools or district-wide, working with them to say, okay, you really need to go to this level. So we're going to rely on some of that expert medical advice from the local area as well. I would love for us to say right now that we can start the school year at green and not have these restricted people that are in the audience now, and they can't see them on YouTube, but they're all wearing masks, and I doubt that any of them are comfortable wearing the mask right now. It is not ideal for students, especially younger students, and so we want to try and find that balance between what's best and appropriate for different levels of learners based on the classroom setting, based on other parameters in that classroom, with trying to mitigate the transmission. So I would love to see the cases start to go down, trend down in the Tulsa area. It would give us all a little bit more confidence that we could start the year at green, go a couple weeks, see how things go. If things don't get worse, kind of stay at green. That would be our goal. I just can't say right at this moment.
I guess that's a follow-up question.
It is.
I'd like to make sure that we make this determination between green and yellow based on what's going on in our community and
Yes.
our school. Not to discount what might happen in Tulsa or any other schools, but I'd really like to be focusing on what exactly is happening in our schools. Because in the other way around, we may need to jump to a yellow before somebody else moves, or to a red because of what's happening in our community. But I also don't want to jump to these levels too soon, because I do think, I mean, the masks are a big issue. It's a hot topic. I'm not that much of a fan of having kids wear it, but I understand. My initial thought process was, there's no way we're gonna have these kids wearing masks and being able to pay attention. But when you start to consider, your teachers and trying to keep the safety of our staff and bus drivers, like you said, I've heard multiple people talk about buses being hot in masks. And that's probably, it is true. I was starting to sweat in this mask sitting right here. I couldn't wait to talk to take it off, to be honest. But when you consider the bus driver, how do we expect that bus driver to climb in a bus and drive all those kids if they're going to be exposed? So I guess what I'm trying to say is I'm one of the ones that's quickest to say, to be skeptical about everybody wearing a mask. But on the other hand, I also understand that we're doing it for the courtesy of others, because a lot of people don't really understand that these masks don't protect. This mask does not protect me. Only a certain kind of mask, and that's an N95, not a surgical mask, but N95 mask that's properly fitted. That's the only kind of mask that's really going to protect you from the virus entering. This mask I'm wearing, the courtesy to protect everybody else. So I think there's a little misunderstanding there. It's not about protecting yourself, because this is not going to protect me. It's hopefully I might protect somebody else. Like you said, the numbers are still kind of vague on whether that's the case. I think we're going to find out soon how much these masks really do work. But I guess my biggest concern was I want to make sure that deciding to go from this level 1 to level 2 is that we're looking at our school and our community.
That's a valid point, certainly something that we would look at. I can say that with masks, and we're going to talk here in just a few minutes about what do we do when we identify somebody that has COVID symptoms or test positive for COVID, and what that process is for contact tracing, determining who's been in close contact with that individual in school. One of the first questions that the Tulsa County Health Department or health professionals say is, did they have a mask on? Because the mask is considered a mitigation of risk. So if I'm within 6 feet of another individual and I don't have a mask on for an extended period of time, I'm considered being close contact, and then I would have to, the quarantining process would have to take place. But if I can say I was in a mask the whole time I was in contact and I was 6 feet away socially distancing, it gives us a little bit of room where we can say, monitor your symptoms. You may not have been exposed because we can't determine you've been in close contact, and not necessarily trigger self-quarantine. So it gives us a little bit of wiggle room. One of the reasons we have put these levels in is most districts have simply gone one way or the other. We want to make sure that we've got that flexibility to make decisions doing exactly what you say, Mr. Cheatham, based on the conditions here in Bixby, not necessarily what's happening in Oklahoma City or even Owasso, basing it here. So, valid point.
I would say too that looking at the exposures and the diagnosis, a lot of concerns and questions parents have had for me is when there's a kid when there's a child in my kid's class that gets it, what's the procedure, what happens? We've discussed that a little bit, but Jennifer, you mentioned earlier too, or Jessica, I'm sorry, you mentioned earlier too about the absence policy for our students, and I think it needs to be, I would recommend it be highly stress the responsibility of each parent to keep their child at home. But I would say as a parent of 4 kids, if my kid is kind of feeling in the past, you know, like they're fine, they're not running a fever, but maybe have a stuffy nose or a little cough, well, that's a symptom of COVID. But a reason why a parent does send their kid to school is because of the absence policy, right? Well, they only get X amount, they're not throwing up today, so I'm sending them, right? Like, or they're not running fever for 24 hours. So there's that pressure to send your kid to school. But with the access, hopefully, that our kids can have of learning online, even if they're just maybe sick, maybe not sick, but they're taking extreme caution. And as a parent, I'm saying, I'm not going to send my kid to school today, but are they still going to have access to do school at home that day, or will it be an absence?
That's our intent. It's great that you brought that up, and it's actually, we're going to get into it a little bit later, but a couple points I want to make there. First of all is the critical importance of the self-screening process for families and for staff members, because what we want to do is keep schools open. That's only going to happen if families in our community work together to make sure that we're not exposing the school district or schools to potentially sick children. But the point you made about sniffles or runny nose, things like that, we've got a lot of students who have allergies. So parents know your children best, and if they have a runny nose, but you know they're always, every September, they have an allergy to pollen and have that, then that may not be enough to say, well, you need to stay home. But if you start seeing multiple symptoms, they have stuffy nose and elevated fever and scratchy throat or coughing, then I think you would have to make that decision. But we're going to err on the side of caution. That's where we're going to encourage parents. But the policy that was currently in place, and this is in the guidelines, that's currently 95% attendance for students, that is waived for the time being. We want parents to know, do what's best for your child and your family. Don't take unnecessary risks. We will be able to provide instruction for your child, even if they're at home for a day. We'll figure out something, or we'll give them extra time to make those assignments up. We don't want families to have any added pressure to make a decision to send a child to school who might be sick. So I'm glad you brought that up. Any other questions about instructional models? And we'll dive into some of these other areas. Okay, I know this is a lot, and we're going through a lot of detail here. Mitigation protocols. This is just general daily wellness screenings. We're going to talk about that a little bit more. Response to possible symptoms, what happens when we identify a child or a staff member in our school that has symptoms. Hygiene is going to be critically important, and we're going to really focus on helping kids wash their hands, not touch their face, use hand sanitizer, keep socially distanced, all those sorts of things. And then face coverings, which certainly hammered a lot. So next slide, talks about physical distancing, and this is stuff that we all know about by now, right? After 4 months of COVID in our society, we know what physical distance means. So we're going to encourage our teachers to do everything they can, both in their classrooms and when moving kids in the hallways, to try and adhere to physical distancing. And if we can't do that, then we're encouraging the use of masks so that we don't expose a large group of students at the same time. So we'll just kind of quickly go through that. That one's pretty, makes sense. Next one, Marcella. Modified layouts. Our principals do work with staff about what they can do in their classrooms. This is going to vary. So if I've got a high school classroom that has 34 kids in it, it's going to be really challenging to social distance. If I've got a special ed classroom with 12 students, but I do a lot of centers and I work a lot of one-on-one, it's going to be very difficult to socially distance because I need kids very close. Some of our school psychs and our speech language professionals, it's really difficult to do instruction with a mask on because kids need to see their mouth and see their emotion. So we're going to have to be flexible. It's going to vary from site to site, classroom to classroom, but we want at least these considerations in place so that we're doing everything we can. Procedures for the use of restrooms, how we space our PE classes. Our PE teachers are going to have to be a little bit more creative in coming up with activities that allow for greater social distancing, because masks and PE don't make a lot of sense. It's difficult for kids to breathe as it is. Likewise, for recess, different protocols that we can work, maybe staggering recess times. And then water fillers. The plan right now is to disconnect all of our traditional bubble water fountains, because it doesn't take too much to see that that's a potential source. Kids slurping out of the same water fountain. So we're going to try and replace as many of those. In most of our schools, we have those bottle fillers, and we're going to try and obtain those for the schools that do not between now and the start of school, so the kids can bring clear water bottles to school, fill them up there, and use that. Many of our classrooms, our new campus at West has a sink and a water fountain in every classroom already, so it's going to be easier at some sites than at some others. Next one. Field trips and gatherings. Here's a slide that a lot of people are not going to like some of the information here. Again, this is our plan right now. These things could change by the time we get into September, October. We don't know, but right now, visitation of classrooms by adults outside of the school are not going to be allowed unless that visitor has a defined need. And the principal is going to have to approve that. So we're talking about IEP meetings, staffings with teachers, things like that we can't do virtually, that we need to have a face-to-face meeting. Those would be the only exceptions, and those visitors will have to do a self-screening before they're allowed into the building. All students, staff, teachers, visitors in the main office are going to have to socially distance and wear masks at all times. We've got to keep those areas sanitary because there are so many people that come in and out of those offices. We just have to do that. Off-campus field trips will not be permitted until health conditions improve. We're not going to unnecessarily expose our kids to potential exposure outside of the school. All school assemblies, pep rallies, Rise and Shine, or GE assemblies, other large in-school events are suspended until further notice. We've got to get back into school and take appropriate precautions, at least initially, to make sure that we are not making ourselves more vulnerable. And then attendance at school events, sporting contests, and other group activities may be restricted. We're still waiting on guidance from the Oklahoma Secondary Schools Activities Association on crowd size. We're not sure what leadership they're going to provide on those topics, so it may be just local school districts trying to come to consensus as to what that might look like. It may be different at the fall or the Friday night football games. It might be different at volleyball games inside. We're going to have to make some judgments about what's in the best interest, because we don't want to do all these things in school to prevent transmission, and then let's have 6,000 people come to the football stadium with no masks and do that. It doesn't make a lot of sense to have that kind of thing. So we're going to have to really look at that, especially getting closer. And the use of facilities by outside groups, which we've got a lot of groups that use ours. We're going to have to implement some additional cleaning protocols. So our fee structure for those events may have to increase as well to provide for that. Any questions on any of this? The next slide really just talks about, and I think Mark, I believe, we are going to do some, we're looking at all of our different areas and how often we're going to clean those. I wish I could say that we're going to go into every classroom every night and use our bleach machines and disinfect thoroughly. We simply don't have the capacity to do that in 350 classrooms every single night. We are going to do it every week, and we'll do it if there's a suspected case in that classroom, but it won't be every single night unless we get to a point where we're having to do extra protocols. Buses, We'll talk some more about protocols, but we're going to ask our bus drivers to wipe surfaces between routes as much as possible, and then we are going to disinfect all buses at the end of every day so that they're clean the next one. Next one. This is very small, hard to read, but encourage our families who are tuned in to read through this. It's going to be tough on some of our bus drivers. Typically, our bus drivers arrive in the morning and they come into a large area. They enjoy a cup of coffee and conversation with their colleagues before getting on their bus. We're going to have to greatly restrict that. So bus drivers are going to check in. They're going to do a self-screening. We're going to have them sign in, get their keys, and go to their buses and drive their routes. So that's going to be a different process. We will do everything we can to try and keep our bus drivers separated from each other. We're going to give them the clear face shields because driving with a mask is even more difficult than talking or teaching because you've got to be able to see. And those of us who wear glasses, if you put that mask in you don't want bus drivers' glasses to fog up traveling with 50 kids behind. So we are going to add some processes there as well. Our bus aides will probably have full PPE, which means masks, gloves, coverings, because they do deal with some students very close proximity who require some special care. We want to make sure that they're safe. Even the fueling and maintenance of buses, trying to limit the number of people who are exposed to those stations to only a key number. Part of that. So next one, student protocols. We're going to ask, again, we don't have somebody at every bus station or bus stop to make sure, but we're going to say, hey, stay away. Now, is that going to happen? I don't know. That'll be up to families to try and communicate to their children the importance of trying to stay a reasonable distance from other students at bus stops or wear a mask. But again, they will have to wear one on the bus at all times. I know that's a huge inconvenience, especially for younger kids who have a long route, but it's the least we can do to try and keep our bus drivers safe. And then again, we're going to try and train kids to limit touching of common spaces, top of seats as they walk back. We'll see how well that works once we get there. Next one. Screening and symptoms of COVID-19. There's a lot here. We don't need to get into a lot of depth here, but we're going to have families do that self-screening every morning. We were talking with Dr. Dart just this afternoon, and somebody asked a question about, do they recommend temperature screenings for all students every day coming to school? His answer was, no, it's not practical. In fact, it would cause a choke point at every school trying to get kids in, and that would probably cause more issues than not temperature screening. He also validated what many of us already know, is that many students, even if they're COVID positive, are asymptomatic, don't have a temperature anyway, may have rode to school in a warm car or a warm bus or worked out earlier. Temperature is not a great predictor unless combined with other symptoms. So we're not going to make that part of our protocol simply because it's too difficult and it's not, doesn't give us great information. That's so important for families. If families and parents want us to be in school and stay in school, we need to make sure that as many as possible are doing those daily screenings and making decisions that are in the best interest of not only their child and family, but the school district as a whole. And then the employees will do that as well. Next one, so that's good. When we have suspected cases, we will have a procedure, and we're still working on this with our nurses. Our nurses are off right now, but we've met with some of them. We will have a well-defined process for bringing that student, isolating them, putting a mask and face covering, doing a check of that, and then if we make the determination, the nurse believes that this could be a suspected case, making the appropriate communications to parents to bring that child home and starting that process. There will be a form that we use to track that, and then that will trigger a series of steps moving forward. Same process really with an employee who is at work and then develop symptoms. Next one. So if somebody tests positive or suspected, you can see what happens on the left-hand side of the slide, and this is in a lot more detail in the bigger handout. But we're going to come in, we're going to clean the surfaces that employee may have touched. We're going to do some contact tracing to find out who that employee has been in close contact with. And if we send them and they have a positive case, we're obviously going to work with the health department and then take additional protocols. If they are positive, they go and they get a test. One of the big challenges we have right now with testing is the lag time. At some of the labs, it is 5 to 7 days before somebody gets results. That is simply too long, and that needs to be corrected. It's not something we can control, but somebody needs to fix that, because if we send an employee home for suspected case of COVID, and we have to wait 7 days, then contact tracing has no purpose whatsoever, because we don't know who that person's been exposed to. So that's got to get a lot better. And that's one of the things that causes me anxiety, is that inability to get good results quickly. We will, if we have a positive case, whether it's a student or staff member, we will notify the appropriate people who may have been in contact with that child. We don't want to cause unnecessary alarm, so we're not going to take, there's a high school student who's positive, we're not going to send that out to the entire district. They don't need to know that level of detail. But students that are in that child's class, that teacher, other staff members who may have been in the same proximity, we will communicate appropriately with the people who have a need to know. Not name, be simple. A child in your class, a teacher in your building, that's that sort of thing. We want to respect people's privacy while still giving people knowledge that they can not necessarily self-quarantine, but monitor their own health and symptoms. Next page. Process is really the same for students. We'll have self-quarantining, return to school protocol. And if we want to go to the next page, we'll kind of show what that looks like. This is straight from the CDC. This is the guidance for the return to school after somebody has had symptoms or is tested positive for COVID. This could change once schools get back in place, but this is what it is now. I see no reason to deviate from what the experts have recommended in this particular case. So if we have a child or staff member who tests positive or has COVID symptoms and doesn't have a result, we're going to assume that they're positive until we know otherwise. They have to stay home for, these are 3 conditions, not 4. There are 3 conditions that are on top of each other. 3 days with no fever, and that includes without fever-reducing medication, and improved respiratory symptoms, which means they're not coughing and sneezing and doing all those things, and 10 days since the symptoms first appeared. They must meet all 3 of those conditions before they can return to school, or have 2 negative COVID tests given at least 24 hours apart. That comes back to the same issue. If we don't have timely testing, that one's going to be really difficult to meet. So the next one, a child who's tested positive. I'm sorry, no, go back to that last one. So we do have kids who are asymptomatic and have no symptoms whatsoever. So if they are positive because they've gone and gotten tested, because maybe they were in the same classroom as a student who was positive, parents brought them, but they have no symptoms whatsoever, they can return to school after 10 days with, since they had their test, and then 2 consecutive negative COVID tests 24 hours apart. This is what the CDC guidance is. I'm sure this will change, and we'll have to work through a lot of scenarios if we start getting cases. So this part could change, and this is the area that really gets complex, because if we, I'll use a hypothetical that we've talked about, if you have a kindergarten teacher who tests positive, it is almost impossible to say that that teacher wasn't in close contact with every kindergarten student in that class. It's just the nature of being a kindergarten teacher. They're around those kids and they're close up. So that will likely trigger a quarantine for that entire class. Now, different at the high school. If we have a math class and the teacher spends most of the time in the front, maybe does some interaction with students, but isn't in close contact for 6 hours with a group of students, then that could be a notification that an employee had positive, needs to quarantine, but monitor your symptoms. So there are some gray areas to this that we're just gonna have to really navigate, rely on our experts or medical professionals and local experts. Yep.
I have a question on testing.
Sure.
Who notifies the school of a positive or negative COVID test? Because the reason I ask is, I'm not really a fan of the school having to call parents to try to overstep the school bounds to try to figure out what the result of the test. Is that something the CDC steps in and is involved in, where we don't have to be?
Well, Lydia, I know you've had some conversations. I heard you talking earlier. Do you want to address that?
Sure. The nurses have typically had contact, would expect typically to have contact from the Tulsa County Health Department, because every positive result is reported to them with a medical professional or laboratory that found the positive. So typically, they would be the ones to contact the nurse. Because of the volume of cases, currently the Tulsa County Health Department is telling the families to do it. So we're going to be dependent upon that relationship between families and us, and they are supposed to contact us. Do I believe that will always happen? Maybe not. That's right now the protocol. We do have a couple of nurses who know people who work who worked previously with, and know people who work at the Tulsa County Health Department, and they're working on it.
I was kind of curious about that, because that could be a whole new area to try to mitigate through.
Having said that, Justin, I do want you to know, when I talked with the nurses, we had a virtual meeting last week, I think it was, and they're actually pretty confident and pretty comfortable contacting families. From a care perspective, I'm just following up, make sure the child is doing all right, what the status is, what can we do to transition him or her back into school. They do that kind of thing anyway right now, before COVID. So I don't think they're uncomfortable with just extending those questions a little further, or making that contact a little more frequently because of the potential for a COVID diagnosis.
Now, is the Tulsa Health Department protecting our nurses once they reach out to a student or a parent of a student, and then we start notifying people that are possibly exposed? Is that nurse protected from HIPAA violations?
We're not going to divulge who it is, ever. So we won't reach, I can tell you our nurses are extremely conscientious about HIPAA. So because they live in both worlds, they understand HIPAA and FERPA, and we're highly conscientious about that. So I'm not as worried about that piece because they're so good at it. And they've already made that part of the protocols when they contact families now. So occasionally, they have to do this. It's a poor comparison because, don't misunderstand, I don't think this is an equivalent concern, but they do that now for lice, right? I mean, they sometimes have to contact a classroom to say that this has happened and you need to check your child, or I checked your child today, and so they're used to how to keep things confidential and still honor HIPAA, but still make the contacts they need to make.
And a follow-up question I'd have, if we're in a yellow, and I know this, we probably haven't crossed this bridge, but I'd be curious to get some information. If a teacher comes down with COVID, we talked about the exposure, but if everybody has a mask on, are they considered being exposure because they have a mask on, or does that not make any difference at all?
I think at that point, we're going to have to defer to CDC guidance, which talks about they have different risk levels, low, medium, and high, based on the amount of time, both masked and unmasked. So if we are talking about a circumstance where you're within 3 feet of somebody, even with a mask, but for 30 minutes, that puts you in a high risk category, and we may have to make a decision to quarantine. But if it's less than 15 minutes and social distance over a period of time, it's really going to be a case by case, and that's why I think it's important for us to have this COVID response team that includes not only representatives from the district and nurses and administrators, but outside entities who can help guide us through some of those difficult decisions. And I'm hoping we have none of them to do, but we're trying to be honest that we will. The aspect of the family reporting, again, I can't stress it enough with the families that are here today and the families who may be tuning in or watching this video later. This is a collective responsibility of our entire community. If we want to stay in school, we all have to do our part. If we want masks to go away at some point, we all have to do our part. And nobody's happy with some of the decisions we're having to make, but we're doing it for the best interest of kids and our staff members, and we just need everyone's support in order to make it work. So, thank you. And then I think we just have one last slide that talks about PPE. We've already had several meetings about our requirements for PPE. One of the challenges here, and I don't want to hammer anyone, but it's funding, because these costs, as Mr. Diver talked about, that hand sanitizer, even at $10 a gallon, we're going to go through many, many gallons of hand sanitizer. We're going to go through many, many masks. And these are things that we don't necessarily budget for. And Bixby receives some of the CARES funding, but most of that is going to support technology needs and making sure we've got enough Chromebooks and software and hotspots and things like that. So we don't have a lot of extra money sitting around for PPE, but we're going to do what we need to do to protect our staff. And so we know that there are individual positions. I mentioned some earlier, the speech language people, some of the special ed teachers. You'll notice here over behind me, we've got a plexiglass shield around our receptionists. We're putting those in all of our main offices in all of our schools, attendance offices, to provide an additional layer of protection for our staff, because they are valuable to us, and we need to make sure that we're keeping them healthy and well and able to come to work. And with that, I think that's a very quick summary, hour and 10-minute summary of our protocols. What I would encourage those who are viewing and those that are here is really do take the time to look at the different levels, see what protocols are in place, understand that the recommendation we're making to the board tonight is to approve this framework as it is, knowing that this is going to change based on conditions here in Bixby schools and based on the transmission of COVID in our community. So the board, I appreciate their support and their trust in helping us develop this plan, knowing that they're the ones who are going to get a lot of calls and texts and emails about the plan. But really, it is what we think is in the best interest of our school. We know coming back, getting kids back in school is the ideal scenario. We want to do it, but we need to do it safely. So with that, I'll open it up for any additional board questions or discussion.
I have a question just on funding, because our schools are always short on funding. If parents or the community wants to support the district with cleaning supplies and monetary and that, what is the contribution? What is the best way to go about doing that?
At this point, I hadn't really thought about that, but I think Jessica Jernigan, as our Director of Community and School Outreach, would be a great, if you would put those people in contact with her.
With Jessica,
start
okay.
a list, and maybe we'll provide more information about how people can do that. And we greatly appreciate any support the community wants to give us.
Well, I would just like to take a minute on behalf of the board to thank all of you for putting all the work that you put into this and the thought, and I know it's weighs heavy on all of you, so I just would like to thank you all for doing this. That's a lot of work. I know you worked hard, and we appreciate it.
I want to reiterate that. Thank you. I mean, just, being a board member and reading about everything and, getting contacted, it's a lot of emotion. And I appreciate you guys really taking the lead, and I think that you've done a really great job. So thank you.
We certainly appreciate those positive comments and your support through this, and it's not going to end tonight. It's going to go on for a few more months, unfortunately. But thank you.
Yeah, I know I've spoken a lot, but I am proud that we came up with a multi-tier system and not just a hard line in the sand, so you know this is what it's going to be or not. I know this took a lot more work than just saying yes or no on certain issues. I do like the tier issues, and as far as parents and teachers alike, I know everybody's got a different opinion, and like I said, we know we're going to get emails and calls on concerns of this. I know I don't want to speak for everybody, but I'm pretty confident in this. All of us appreciate all of your guys' opinions, no matter what side of the fence or discussion that you may be on. It really does help us get a full picture of where our teachers, staff, and community is. So even though sometimes it can be overwhelming, we do appreciate being able to get a grasp on what everybody's thinking.
Not to add to that, Mr. Cheatham, in the survey that closed 3 weeks ago, we received over 1,500 individual comments from families and staff members, and I can tell you that I read every single one, and many of them were repetitive on the same topic, but we have tried to consider all of those and incorporate those into our planning for this. Likewise, the link that we're going to be providing tonight is meant to be, it's not just to satisfy people and stop them from emailing. That's not the intent. It's that we truly want to hear what their concerns are so that we can make sure that we're adequately addressing those. Because at the end of the day, we want every child, every parent, every staff member to feel comfortable returning to school and doing their job. That's what we want.
Awesome. I'll say too, since everybody's talking about it, I'll say too, it is a rare opportunity in our lifetime to show some resiliency between our community and our staff and our kids in our school. And I, for one, am just ready to get back to school. I'm ready for, I think I speak for everybody, but I have a new high schooler. I have a sixth grader and 2 first graders. So I'm super excited about the opportunities. And somebody said it best the other day. They said, I'm just ready for subject change. Like I'm ready to focus on something else. And I think we can all get caught up in the community and wearing a mask or not wearing a mask. But I believe the subject change is school starting again and getting our kids back in that routine, and my grocery bill going way down, because the snack expenses is crazy. But anyways, it's a rare opportunity for our school district and all school districts across the country to our staff to have just the utmost positivity. I know there's a lot of concerns and there's a lot of heaviness. It's thick on staying well, but just as parents in this community, that we can turn it into a positive and encourage our kids to learn and get back involved. So that's really do appreciate your all's hard work on this. And I think with the tiered system, it'll really allow us to, move forward effectively and, take care of business for the next school year. So appreciate y'all.
And I'm hoping the tiered system gives teachers some peace of mind. I like the fact that teachers have a choice of asking kids to wear a mask or not. I've heard from some teachers who are very concerned about standing in a closed-in room in front of 30 kids. And please know that we all take that to heart as well. So, yeah, I think I like the tiered system. I think it makes me feel better.
And I'll just say this, I do appreciate the modeling that our board has done. We have had, other than the one virtual meeting I think we had when this first broke out, we have tried to have physical meetings where the community can still be involved, knowing that we need to take appropriate precautions, social distance, use of masks, but that we're not asking teachers and staff to do things that we're not willing to do ourselves. So I appreciate your leadership on that.
Okay, I will make a motion that we approve item 6.1, the Bixby Public Schools Return to Learn and COVID-19 Protocols and Procedures Guide for 2020-2021. Call for a vote, Matt.
Aye.
Justin.
Aye.
Christie.
Aye.
Amanda.
Aye.
Chair votes aye.
Before we go on, that we are going to terminate the live feed at this point. Again, for those who have been tuning in on YouTube, please do take the opportunity to provide any feedback that you have at the link that's provided there. We thank you for tuning in tonight, and we look forward to a great start of the school year in 4 weeks. Thank you.
Okay, 6.2, discussion, consideration, and vote to approve or not to approve a service agreement with the International Center for Leadership and Education.